Hi, welcome to the chapter 28 that is called Oncology. We're going to be doing the same as always. So let's start. Chapter 28 Oncology. A. Neoplasms. A neoplasm is an abnormal new growth of tissue. Malignant neoplasms, cancers, are likely to spread and cause serious illness or death. Many neoplasms do not spread and are less harmful. When speaking to patients, doctors generally say growth or tumor. The doctors can say, you have had a small growth in the bowel or you had a small tumor in the bowel. A lump or swelling is a collection of tissue or fluid which is visible or palpable, can be palpated or felt with the fingers. A lump may be due to a neoplasm, but there is other causes such as inflammation or fluid accumulation. Patients say, I have a lump in my left breast. The doctor says there was a firm palpable mass in the liver. Malignant tumors are characterized by rapid growth and invasiveness. The tumors may invade a local tissue or may spread to distant parts of the body. Metastasis. Neoplasms, which are results of metastasis, are called secondaries, as opposed to the original tumor, which is the primary. We have the results of the scan back now, and I'm afraid they show that you have a small growth in the prostate. Fortunately, it appears to be an early stage and there is no sign of spread. So, so if we remove, there is a very chance of a complete cure. Note: the invade bird is to enter and spread throughout a part of the body, and this process is invasion known. If a tumor is described as invasive, it has the ability to spread. B. Symptoms and signs of malignancy. The symptoms of malignant disease may be related to the size and location of the tumor. For example, a spinal lesion in the brain causes braces, intracranial pressure, and symptoms such as headache, vomiting, or visual disturbance. Tumors of the colon may obstruct blood, the lumen, and cause change in the bowel habit. Other possible symptoms of malignancy include bleeding, pain, and weight loss. Case 38. A 30-year-old man presented to his GP complaining of a pelvic lump on the right side of his neck, which has been present for about 2 months and was enlarging. He has been feeling generally unwell and has lost about 5 kilos in weight. He also complained of night sweat. He had no significant past medical history. C. Treatment of tumors. A tumor can sometimes be completely removed or excised by surgery. If this is not possible, for example, if it has already metastasis to other parts of the body, it may be possible to destroy it by radiotherapy or by chemotherapy. See Unit 42. When a cure is not possible, palliative treatment is given, which is only intended to relieve symptoms. We're gonna translate now. 28. Oncología. A. Neoplasias. Una neoplasia es un nuevo crecimiento anormal de tejido. Las neoplasias malignas, cánceres, tienden a propagarse y causar enfermedades graves o la muerte. Las neoplasias benignas no se propagan y son menos dañinas. Al hablar con los pacientes, los médicos generalmente hablan de crecimiento o tumor. Tiene un pequeño crecimiento en el intestino o tiene un pequeño tumor en el intestino. Un bulto o hinchazón es una acumulación de tejido o líquido visible o palpable que se pueden palpar o sentir con los dedos. Un bulto puede deberse a una neoplasia, pero existen otras causas como la inflamación o la acumulación de líquido. Los pacientes dicen, tengo un bulto en la mama izquierda. Los médicos dicen, había una pequeña masa firme y palpable en el hígado. Los tumores malignos se caracterizan por un crecimiento rápido y su invasividad. El tumor puede invadir los tejidos locales o extenderse a partes distantes del cuerpo. Metástasis. Las neoplasias, que son el resultado de la metástasis, se denominan secundarias a diferencia del tumor original, que es el primario. Ya tenemos los resultados de la exploración y me temo que muestran que tiene un pequeño crecimiento en la próstata. Afortunadamente, parece estar en una etapa temprana y no hay signos de propagación. Por lo tanto, si lo extirpamos, hay muchas posibilidades de una cura completa. Nota: invadir verbo es entrar y propagarse por una parte del cuerpo y este proceso es invasión, sustantivo. Si un tumor se describe como invasivo, tiene la capacidad de propagarse. B. Síntomas y signos de malignidad. Los síntomas de una enfermedad maligna pueden estar relacionadas con el tamaño y la ubicación del tumor. Por ejemplo, una lesión que ocupa espacio en el cerebro causa un aumento de la presión intracraneal y síntomas como el dolor de cabeza, vómitos o alteraciones visuales. Los tumores del colon pueden obstruir, bloquear la luz y causar cambios en el hábito intestinal. Perdón, la luz no, el lumen. Y causar cambios en en el ámbito intestinal. Otros posibles síntomas de malignidad incluyen sangrado, dolor y pérdida de peso. Caso 55. Un hombre de 33 años acudió a su médico de cabecera quejándose de un bulto indoloro del lado derecho del cuello, que había estado presente durante unos 2 meses y que estaba aumentando de tamaño. Se había sentido mal en general y había perdido unos 5 kilos de peso. También se quejaba de sudores nocturnos, no tenía antecedentes médicos significativos. Tratamiento de tumores. A veces un tumor se puede extirpar por completo o extirpar mediante cirugía. Si esto no es posible, por ejemplo, si ya ha hecho metástasis a otras partes del cuerpo, se puede destruir mediante radioterapia o quimioterapia. Ve a la unidad 42. Cuando no es posible, la cura se administra un tratamiento paliativo, cuyo único objetivo es aliviar los síntomas. Okay. Uh, uh, Exercises 28.1. Complete the table with words from A, B, and C opposite unrelated forms. We got the verb, the noun, and the adjectives. We got the curative. Size, excision, growth, ground, and growing. Invade, invasion, and invasive. Obstruction, and obstructive. Palliate, palliation, and palliative. Palpate, palpation, palpable. Spread, and spreading. Swelling, or swollen. Uh, uh, 28.2. The notes below are about the patient described in B opposite. Use 10 to put the sentences 1 to 9 in the correct order. To make the next paragraph of the case report, use Appendix 2 of the page 20 if you need help with the abbreviation. Uh, Examination of the central nervous system was normal. Is a CNC? Not. 2. His mouth and throat were normal. It is oropharynx not. 3. There was a smooth frame trip forms a mass in the right supravicular fossa. Is a smooth frame for mass in the supravicular fossa. 4. His cardiovascular and respiratory system were normal. It is a not arrested not. 5. On abdominal examination, there was a mass palpable 30 centimeters below the left costal margin. It is at mass palpable 3 centimeters below L costal margin. 6. On examination, his temperature was 37.8 Celsius. That it is 08 temperature, the number. 7. There were larger lymph nodes in both axillary and inguinal areas. It is nodes 1 to 2 points in diameter, palpable in both axillary and inguinal areas. 8. His pulse rate was 100 per minute. Regular and blood pressure is 112 under above 66. That it is that it is okay, that it is pulse is 100 per minute, as I say, and blood pressure 112 about 66. Okay, 28.3. Complete the sentences. Look at A, B, and C opposite to help you. 1. Distant spread of tumor cells is known as metastasis. 2. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. 3. The opposite or of painful is painless. 4. A malignant neoplasm is called cancer. 5. Tumors which do not invade or metastases are benign. 6. Secondary tumors are those which result from the spread of a primary. 7. If a cure is not possible, palliative treatment should be given. 8. A palpable liver suggests metastasis. That was all for today's chapter. See you in the next chapter. Bye.